Osteosarcopenia is a geriatric syndrome that combines two conditions: osteoporosis, which is the loss of bone density, and sarcopenia, the loss of muscle mass and strength. This dual condition is increasingly recognized as a major health concern among older adults worldwide, affecting about 21% of the population. Osteosarcopenia not only increases the risk of fractures and functional decline, but also makes recovery from illnesses and surgeries much more challenging. As the global population ages, more older adults are undergoing major surgeries, such as cardiac, orthopedic, and cancer-related procedures. In these situations, osteosarcopenia can significantly worsen outcomes, leading to longer hospital stays, more complications, and even higher mortality rates. Understanding this syndrome is crucial for improving the care and prognosis of older surgical patients. Presence of osteosarcopenia in older adults has a profound impact on their prognosis following major surgery. Studies show that the prevalence of osteosarcopenia varies by surgery type. In oncological surgeries, it ranges from 12% to 44%, while in orthopedic procedures, it can be as high as 100%. Patients with osteosarcopenia face higher risks of complications, such as delayed wound healing, infections, and prolonged recovery time. For example, after hip or vertebral fracture surgery, these patients are more likely to experience new fractures, greater disability, and increased mortality. In cancer surgeries, osteosarcopenia is linked to poorer nutritional status, more aggressive tumor progression, and shorter survival. Even in cardiovascular and gastrointestinal surgeries, this syndrome is associated with higher rates of severe complications, including infections and bleeding. Clearly, osteosarcopenia is a key factor influencing surgical outcomes in the elderly. Diagnosing osteosarcopenia is complex, as there is no universal standard. Most studies use a combination of bone mineral density (BMD) and muscle mass measurements, often relying on imaging techniques like CT scans at the third lumbar vertebra. However, the cutoff values and methods vary widely, making it difficult to compare results across studies or apply findings consistently in clinical practice. This lack of standardization is a major challenge for both researchers and healthcare providers. Additionally, most research to date has focused on Asian populations in specific surgical contexts, such as cancer and fracture surgeries, leaving other regions and types of surgery underexplored. There is a clear need for more diverse longitudinal studies and for the development of cost-effective, widely applicable diagnostic protocols. Addressing these gaps will be essential for improving outcomes for older adults facing major surgery. Summary: osteosarcopenia is a significant risk factor for poor surgical outcomes in older adults, regardless of the type of major surgery. Its presence increases the likelihood of complications, longer hospital stays, and even mortality. The current variability in diagnostic criteria and the concentration of research in certain populations highlight the urgent need for standardized approaches and broader studies. Early identification and targeted interventions, such as nutritional support and physical therapy, may help mitigate the risks associated with osteosarcopenia. As the aging population grows, optimizing surgical care for those with this syndrome will become increasingly important. Future research should focus on developing practical diagnostic tools and effective interventions to improve recovery and quality of life for older adults undergoing surgery.